Hello everyone, this is Dr. Tia, your cancer specialist. Ngayon po ang pag-uusapan natin ay about cancer and yung relation niya sa COVID pandemic. So I would say this is very timely. Eventually, we will also shed some light on vaccination because we all know parating na ang vaccines here in our country, hopefully anytime soon. And ano bang impact nito sa pag-manage or sa ating mga cancer patients? So, since the pandemic started, nag-start yung mga lockdown, I actually continued to keep in touch with my cancer patients, and given a chance, I continued to see new patients as well. Of course, it's a little tricky kasi itong mga cancer patients natin, especially yung mga actively natin minamanage, have to undergo several treatments, particularly sa specialty ko, yung mga chemotherapies nila. So we can't just stop doing that just because of the pandemic. We had to find ways to continue their treatment since it's very important. So how did this pandemic affect this process that we usually follow? Of course, the fear has always been there because everyone could be a carrier, everyone could be infected. Not just from the frontliners, but of course our patients mismo ang takot na takot, and they voiced out all their fears sa akin. A lot of them, even if schedule na nila, nandun yung takot nila to go to the hospital because they know that there's a high risk that they will contract it. Especially they are a very special population, yung immune system nila is not that good. Madali silang kapitan ng COVID virus. So, yun, it's a real problem that happened. Siyempre, iba natuloy, but a lot of the times, even if I can be physically available to do their chemotherapies, yung mga patients mismo ang may hesitations to come in because of this. So, it resulted to several treatment delays, even some lost to follow-ups na since the lockdown, nakita ko sila, nasa bare months na. And this greatly impacted the treatment process of my cancer patients. But you have to understand their fear is very real. To this day, I would say I have confirmed I had 6 of my patients who actually turned out to be COVID positive. Itong mga pasyente ko to, alam niyo naman, hindi naman sila talaga naglalabas and all that. They follow all the rules strictly, but still, they acquired the virus. So, the fear is really very real. Okay, so the news of an incoming vaccine for COVID is very welcoming for us. Ngayon, nakikita ko namang problem, that's why I immediately wanted to make a video for this. Is ang dami na namang fears concerning the giving of these vaccines. Hindi lang for my cancer patients, but even for normal individuals. Ang dami na naiisip whether the side effects are very dangerous and all that. Which is understandable, of course. Sometimes not knowing something that well will really result in fear. That's why I hope with this video I could clarify some things regarding this problem. So, ayan, since the news of the vaccine came in, I have a lot of my patients talking with me casually regarding this, slightly hinting, o Dok, kukuha ba kaming ganito? So, the easy answer to this is yes. Whether the patient is newly diagnosed cancer, may active treatment na nangyayari, gagawa ng surgery, cancer in remission, cancer survivor, all of this, lahat sila, they will all benefit from getting their vaccines. In fact, since they are a high-risk population, they are a priority for these vaccines. Okay, so let me add further enlightenment sa special populations pa ng cancer patients. In this case, ang special population natin are those who are undergoing active treatment. So, treatments like chemotherapy, you have radiation therapy, you have targeted treatments, all of which ginagamit natin for cancer treatment. So, bakit naging special to with relation to vaccination? Remember, one of the effects of these treatments is the effect on the immune system of our cancer patients. So, dahil medyo naapektuhan ng bone marrow, ang one effect of chemotherapy is bumababa ang kanilang immune system. Now, this may pose a problem because if you would look back at the concept of vaccination, remember yung vaccine, you inject an antigen, na yung antigen yun yung mag-stimulate ng antibodies. And these antibodies are the ones that combat the actual disease. In this case, yung COVID. No? So, pag medyo mababa yung immune system, nandun yung worry, baka hindi mag-produce ng antibody enough. No? So, wala pang enough evidence to show how significant yung effect ng chemo is with relation to vaccination. But as a general consensus, the experts decided na the benefits would still outweigh this possible problem, because side effect wise, wala naman nagbago. I mean, one worry, baka magka-COVID daw if you give the vaccine, especially itong special populations na no, it will not happen. So, for the general consensus, even those undergoing chemotherapy, recommended pa rin ang vaccination. Of course, your oncologist will tell you when is the best time to get the vaccine while ongoing the treatment, but it's a big help kasi nga, remember, pwede talaga magka-COVID, lalo na yung mga nakikimo, balik-balik sa hospital. So, when you're vaccinated, it adds that security blanket and decreases your risk to actually get COVID. Okay, so how about cancer patients na magpapasurgery? Again, this is not my specialty talaga. I get help from my surgery friends. And ang question lang naman with regards to vaccination in patients who will undergo surgery is the timing. So, should it be before the surgery? Should it be after? Because in general, gusto mo pa rin ibigay talaga. You want to give the vaccine regardless if they need surgery or not. So sa timing, again, it depends on your doctor, no? One concept would be, ano ba yung urgency of the surgery? So some cancers need immediate surgery kasi very aggressive, mabilis kumalat. So in this sense, better mauna na yung surgery. And then after the surgery, after the patient has recovered, saka na lang ibigay yung vaccine. But of course, they just have to follow the proper protocols so that they are safeguarded from getting COVID when they are admitted, when they are undergoing the procedures, which is followed naman on all hospitals. Some cases na maybe not so urgent ng surgery, yan, baka pwedeng unahin yung COVID. And again, it alleviates the fear ng mga cancer patients on going to the hospital to undergo elective surgeries and all that. So, again, as a take-out for this, yes, all patients, cancer patients na magsa-surgery has to undergo the vaccine. And then, again, the timing will be dependent on your doctor's decision. Okay, so that's it. Basically, ang message ko is, huwag tayo matakot sa vaccination. Especially, itong mga high-risk populations natin, like our cancer patients. This is still the best way to protect ourselves, vaccination. The more people get vaccinated, the more we can form the herd immunity, the earlier we can eradicate COVID. So, it's for the good of everyone, basically. And yung worry kasi ng iba, kasi it became a very real problem. Yung iba natakot baka minadali yung vaccine, no? It was pushed, of course, because there's a need, but it underwent the clinical trials pa rin. It underwent countless testing to make sure that it's safe and effective. So, as a takeaway, I know I have subscribers na pasyente ko. So, itong mga cancer patients ko, I know you're listening. Pagdating ng vaccine, pabigay agad tayo. Okay? So, please trust the evidence and trust your doctors that they always look out for your best interests. Thank you, everyone.